Now, the next topic is a really big tool that you can have in the clinic, and Colonel Dauber is the one who put a lot of the work in for this, and then some other people have helped me as well. But you could call it medical cheaters or clinical pearls. I've labeled it currently as clinical pearls, and that's down here in the third tab. If you click on that, it's really nice because what you can do, say you don't remember the different myotomes, you can come in this column A and just float over that, and it's going to tell you where all the myotomes are for the upper and lower extremity. And you've got DTRs and dermatomes and endphils, lots of different things. What I've done is I've tried to make it just a comment so it would be even faster than clicking on something and waiting for it to open. But you definitely can click on these, and if there is a link, and it'll open up something. This one has pictures of lower extremity dermatomes, and you can link your other anything you want to link pretty much. But what's also nice is we got an imaging column, and we have precautions down here, but then we have like the auto anchor rules, and you float over that, and bam, it opens up. Now, if something looks a little bit off, sometimes it's the formatting of the browser you're using, or I'm sorry, the operating system. You can come here, edit the comment, and just resize this a little bit so that it still works out nicely for you. And we'll come back over to that one, and now it looks good. So a lot of different imaging ones here. We also have the American College of Radiology criteria, really useful tool. We have some other links that will help you for evidence-based imaging guidelines here, and that's for your using. And then we have some interaction checker that you can use online, lab studies stuff, cancer stuff, infection, cervical myelopathy, and there's going to be more to come, but these are some basic ones that will be pretty useful for you. There's a little bit on pregnancy resources, but still being developed. And this other stuff over here is just more for you to develop. I have a few things in there already, but I would say that's still being developed. So the other thing that is good for clinical reference are special tests. And what we have here is this tab here. And you can see what we've done is we've put an examination, and we've arranged this by body part and then type of injury, like instability, and then we have list of tests. Then we have specificity and sensitivity next to it. If you float over one of these, it's going to tell you the test, the method, and what makes it a positive test. And as you can see, we have shoulder, knee, hip, ankle, foot, elbow, neck. If we go further over, we also have lumbar. So, we're still adding to this, but there's quite a bit in there for you to use already. Now, in the first column, you also have outcome measures. Right now, the ones that are blue are hyperlinked to outcome measures. And if you also see, there's going to be some information about it. What's a minimal detectable change for the ones that have little red corners, and gives you a little bit more information about it, but maybe what's the best use of this outcome measure. So that is your clinical pearls or medical cheaters and your special test tab.